number of Utahns dying from opioids actually going down. That's according to some new numbers put out by the Center for Disease Control and Prevention.
It is a small win in a battle Utahns have been losing now for decades. Jim Spiewak looked through those updated figures recently released. Jim?
Yeah, and the experts that I spoke with today say that the Narcan, or naloxone as it's called, these kits that are handed out are really helping. And even this nasal spray that the health department issues is a big contributing factor. But think about the message here against this opioid crisis and trying to fight against it. It is everywhere that you look.
I was here. He was in bed.
Darlene Schultz and the rest of her family had just celebrated her son Adam's 150th day without using drugs.
Went back to check on him, and that's when I found him that he wasn't breathing.
It was November 2012.
Worst day of my life.
Adam used heroin, overdosed, and died.
I think back then, it was 6 years ago, I think the stigma, the shame, I didn't really want people to know.
At the time Adam died, Utah had been ranked in the top 10 in the country for years for overdose opioid deaths. 2017 data just released by the CDC, which is the most recent, shows Utah opioid deaths have gone down. Utah now ranks 21st.
We're trying to make Narcan much more accessible to family members and to people who are suffering from the opioid addiction.
A bill was passed a year after Adam's death that helped the spread of life-saving Narcan, and that helps first responders, says Captain Tony Stowe with the Salt Lake City Fire Department.
People are becoming much more aware of it, and we're providing some preventative measures as well.
Which is something Darlene wishes she had 6 years ago.
Recovery's not about making a bad person good. It's about helping someone sick get well.
And Darlene now works for USARA, helping families deal with addiction. They have 15 classes in 10 Utah counties. And coming up in the next few weeks, they plan on opening up new classes in the much underserved area of Beaver and Sanpete County. Back to you.
Knowledge is definitely power in this situation. Jim, thank you so much.